Hi friends, good evening. I'm Dr. Ashutosh Gupta and I'm a consultant of fetal medicine. So today we are going to talk about some cardiac cases. Okay, so identification of those cases at something around anomaly scan at 19 weeks is very important and pertinent. Why is it so? Because then how sure we there as far as that diagnosis is concerned. First, secondly, what would be the likelihood prognosis and how it is going to proceed further, right? So that it might end up into some critical sort of an cardiac abnormalities 3 weeks or 4 weeks or 6 weeks down the line. So still whatever we are identifying at 20 weeks, so still we are left with something around 18 more weeks to go. And so as to see, so probably we make some sort of a fine adjustment how this lesion is going to behave, and then what would be the ultimate prognosis to the cardiac condition as far as the baby is concerned when the baby would be delivering at 38 weeks, right? Third, what would be the finite sort of a situation in which the baby might need a cardiac surgery either immediately after the baby is born or probably 6 months, or probably we would have some time left so that we can take our own time in understanding the whole situation and getting the fetus or the baby operated at 6 months, 3 months, 1 year down the line, right? So we do have a few cases in which we'll discuss about the criticality, and cardiac and then spine are the most of the commonest sort of a congenital abnormality as far as the baby is concerned. It is not about making those diagnoses at 19 weeks. So, identifying the criticality, making the patients understand, taking them along, what would be the likelihood course of that particular situation, of that particular cardiac lesion identified at 20 weeks within the coming gestational age. If there is any genetic abnormality in the background, how do we investigate, and what would be the likelihood prognosis after the baby is born, right? So probably we'll talk about all these things. So today we are going to talk about one case. So this is what we are doing in anomaly scan in 19 weeks. इसको ध्यान से देखिए तो probably we can identify that the RV is hugely dilated, and similarly is the element of the right side of the heart, which is called as the right atrium. The left side of the heart is sort of an hypoplastic. So, and then this is the major trunk, which is pulmonary trunk, which is hugely dilated. And then if you look around, we do have an sort of an inlet VSD, and then it doesn't looks like to be a TOF at the moment. It doesn't looks like to be tetralogy of Fallot, which is one of the commonest cyanotic congenital heart disease. But then this looks could be an evolving hypoplastic left heart syndrome, and then a diminutive LV, the dilated right atrium and the right ventricle, dilated pulmonary trunk, and then very small atriatic sort of an arch of aorta. So identifying the cardiac conditions is 20 weeks, uh, and then looking around probably in one sitting or two sitting in a day or two, so as to reach to as to a finite conclusion, or to be very specific about what we are talking. It is very important. Secondly, we are trying to reach to a diagnosis. Third, what we're trying to identify is prognosticate the ultrasound finding onto the ultrasound, so as to see where exactly it can head in the coming weeks as the baby would grow, what would happen, that how this sort of a lesion can proceed further, and therefore having some time left or to do some genetic evaluation to the fetus so as to identify whether the baby doesn't have any sort of a genetic abnormality in the background. So these are three, four, five things that probably and then a huge amount of counseling, doing the invasive testing, getting the results, talking to the pediatric cardiologists, and taking them everybody along and doing sort of a comprehensive evaluation of the baby, and telling them that this could be the likelihood course and the prognosis if the baby is born, whether the baby would need the cardiac surgery, and what would remain to be the prognosis. So these are different salient points that probably we try to put on, and we try to evaluate the baby in these lines, and so on and so forth, right? So meaning thereby that it becomes very important so that everybody knows, the patient knows, the pediatric surgeon who is going to operate upon the baby after the baby is born, he also knows, and the gynecologist also knows that probably what we are dealing up with, and how do we cater and how do we look around for this sort of a baby with a cardiac abnormality, right? So this is how we look around for all these things, right? Thank you very much for your patient listening.